Hello, everyone. Welcome. Welcome to our virtual town hall for clergy members. We want to thank you for joining us during this busy time. My name is Tom Baldessaro. I'm the Chief Financial Officer here at Inspira. And the first thing I would like to do is introduce the panel members you're going to hear from today. First, I would like to introduce our President and CEO, Amy Mansue.
Hello.
Next, I will introduce Dr. Evelyn Balogun, the Medical Director for Employee Health, Occupational Health, and Urgent Care.
Hello.
Next is Joe Kaufman, our Director for Occupational Health Services.
Hello.
And finally, I'd like to introduce Pastor Diego Cuartas from our Spiritual Care Department.
Hello.
So first, I'll start and tell you why we're here. Obviously, we're going to talk about COVID. We're going to identify some challenges for you, provide you with what's going on in our communities, review some safety precautions, testing options, provide you with resources, tell you how we can help, and then answer any questions you may have. Now, you don't need to wait to the end of the presentation to ask your questions. You can go into the chat box and ask your questions throughout the presentation, and we'll get them to them at the end. So without further ado, let's get started. I'd like to turn the presentation over to Amy Mansue.
Thank you so much, Tom. My job today is to talk to you about the current state of affairs of the COVID virus, how fast it's moving, and as importantly, what it's impacting in our local communities. Globally, there are 1.6 million deaths that have suffered from COVID, with 72 million people that have been exposed. United States, that number is 16 million people who have been tested COVID positive, and 296,000, almost 300,000 people that have passed away. New Jersey, 266,000 that have been exposed to the COVID virus, and almost 15,000 lives have been lost. And then locally, we're almost at 24,200 in Camden, with 685 individuals that have passed away. Almost 12,000 people in Gloucester, with 320 people who have passed away, 6,300 in Cumberland with 186 people, and 2,200 people in Salem County with 97 individuals who have lost their lives. The one item I want to make sure I point out is of grave concern to us is the rate of transmission that we're seeing in our home counties, Gloucester, Salem, and Cumberland. Those counties have been in double digits for weeks now. 11, 10, and then last week, 19% and a 7-day rolling average in Salem County. That's almost 1 in 5 people that would have achieved the COVID virus. So we know that it's very important that we all do the items that the only thing that we know right now that can slow down the virus, and that is wearing your mask, washing your hands, and remaining socially distanced. While we have a vaccine literally that's arrived today and will be available for our employees tomorrow, we do not have the ability for a cure yet. And until then, we must be vigilant. I want to share with you changes that we've had to make in our own system because of the virus. The virus is impacting our own employees in the same way it's impacting our communities, and we're finding that we're having to redeploy staff. In addition, we're seeing many people come to our doors, to our hospitals, both COVID patients and non-COVID patients. Flu season is the very busy time for us in the hospitals, and so we are still treating more non-COVID patients than COVID patients, but it is requiring us to make some changes. And part of those changes is that we're going to have to redeploy our team members, our clinical team members, to be able to assist in what we know is coming. We are going to have to temporarily close a handful of our urgent care centers. We are still leaving some open, but those that we've selected are Woolwich, Glassboro, Mantua, Summerdale, and Haddon Township. Now, when I say that we're going to close them, the biggest item that people are coming to us for in the urgent care centers is COVID testing. So we are going to talk a little bit further about how we've set up some drive-through testing sites to address the issues of difficulty that this will impact you in reference to not having the convenience of being able to go to your center. The drive-through test actually allows us to do more tests than we otherwise would have, because the centers have only a limited amount of people that can go through them in a given day. Remember, COVID requires us to actually disinfect the room that a person is in, and it must sit for 30 minutes. And so by doing that, that then limits the number of people. So by having these drive-through tests set up, it actually will allow us to see more people, although I understand that it is still very difficult for you when we've taken the center out of your home community. But this is an example of some of the changes that we're going to have to make as we move forward, given the rate of transmission that we indeed are beginning to see. I will send this over to Pastor Diego now so he can discuss some of the challenges that the clergy are facing. Pastor?
Thank you, Amy. As a fellow clergy, that means as someone who works here at the hospital as well as a pastor in the local church in Vineland, I feel the pain that you also feel as a clergy during this season. We do know that there are real challenges, especially because now we are in a season where we tend to increase our opportunities to celebrate, increase our opportunities to lead well our people. And so there's a few things that we want to touch on and perhaps even offer you some recommendations that you can implement. So we do know that some of the things that are going to keep safe our community is by making sure that when we congregate, we implement adequate space and social distancing. That is so important. And I know that we can contribute to the safety of our people by doing that. Using adequate personal protective equipment, it's another important aspect. And later on, you're going to hear us talk a little bit about what or how we can maybe even support you in that. Adequate sanitizers throughout the building, throughout your locations so that people can use those before and after the gatherings. Another thing that I think we've seen in the guidelines, even offered by the governor and CDC in New Jersey, is that disinfecting between gatherings, between services, or between sessions is so important, and that also offers a level of a sense of safety and security to children, to adults, to our families. One of the things that I think we're grappling with these days, and I know you're thinking about this a lot, is what about holiday and indoor gatherings? As it's getting colder and colder these days, the option of doing something outside becomes almost non-existent for us, right? So what we need to do is give a little bit of thought to how can we facilitate the things, the values that we want to lead our people in. I do believe that as clergy, we have a role to be leaders, but this season has brought a new layer that we need to think about and consider when we are leading our people. So to speak about one of those things that becomes essential during this season would be the contact tracing. You may be thinking, how can we do that? One of the things that we are doing in our church facility these days is we've stipulated a guideline that if a leader is leading a gathering and finds out that someone was COVID-19 positive or exposed to someone with COVID-19, we are asking that leader to notify the group of participants because it is the fair thing to do. It is the good thing to do so that everyone who participated in that gathering would know how to act. We're also in a difficult season because the flu season began a few months ago already. And flu-like symptoms can also make it a little bit more difficult sometimes to determine if someone has the COVID-19 virus. So we recommend and encourage you to encourage your people to get the flu shot during this season to add that extra layer of protection. During this webinar, we're going to talk about the COVID-19 vaccine in detail, and we are also going to be discussing how our department, in the spiritual care department, is available to help you be able to navigate the system or our hospitals during this difficult time. And with that, I'm going to turn it over to Dr. Balogun.
Thank you, Pastor Diego. So, as you've already alluded to, in terms of what we know works, physical distancing works, screening works, as does use of masks. And with respect to screening, that can take a couple of different forms. It can include temperature checks before we gather in public spaces. Can also include making sure that we do a self-symptom check for the symptoms that are suspicious or raise the index of suspicion for COVID. Again, just to do a quick review, that would include body aches, the general flu-like symptoms, body aches, fatigue, loss of sense of smell or taste, headache or nausea. With respect to masks, mask wearing has been a core element of our response in these months that we've been experiencing in terms of our response to the pandemic. And even in the post-vaccine era, will remain an important measure that we must continue to practice. Again, as Pastor Diego also alluded to, education and communication have been key and will continue to be key elements of our response. And testing, when available, complements all these other practices in making sure that we continue to have a structure that allows us to provide the best response in the moments of the pandemic. With that, I will turn the presentation to Joe Kaufman, who will provide more information in terms of the different types of masks that are available.
Thank you, Dr. Balogun. So as health and safety professionals, it's our job to recognize hazards and risks towards our populations and make recommendations to try to help mitigate those risks. As I'm sure you've seen, masks are at the forefront of that. There are a number of different kinds of masks, and I just wanted to take a second to mention those types. One is the N95 respirator. The next one is the surgical mask, which at Inspira has been what we've done in most situations. And finally, more along the lines of the cloth and handmade masks. The important thing to note here is that a mask is only as good as how it fits. I'm sure that we've seen folks with their noses out or big gaps in the masks, and when that happens, the air is going to take the path of least resistance and it's not going to go through the mask. To try to demonstrate the point further, I wanted to show you a study which has some visuals to show how masks are effective. So in this study, what they wanted to do was demonstrate if someone coughed or sneezed, how far that would go. And as you can see, what they're showing is that this is a folded handkerchief, so more like a handmade. And you can see that there is definitely impact in how far that jet goes. In our next slide, another type of homemade mask. This one, again, has multiple layers. As you can see, it's significantly more effective. The droplets go much less distance. And finally, this is more along the lines of the cone-style store-bought filters. And you can see this definitely makes the most impact. And the point I want to draw your attention to is the graph below, where you can see that, uncovered in this study, their average jet distance was around 8 feet. So just below that is the bandana. And as you can see, it's 3.7 feet, which really tells us that even in the worst case scenario, we're cutting it in half. In the best case scenario, we're all the way down to 8 inches. And so really, it's very important, in my opinion, that we use masks as part of our process to protect people. Some other things that you can consider from a health and safety standpoint that will impact the spread is involving your building, specifically your HVAC, your air conditioning, your heating systems. Now that we are in the heating season, humidity in the buildings are being dropped. And if you have the ability to raise humidity levels, we have seen that there's been a less of the ability to spread. Not just humidity, though. If you're able to add the number of air exchanges in your building, that is also something that, in my opinion, should be considered along with PPE, masks, social distancing, and hand sanitizing. One other point to consider is when you're in your buildings, consider how you can space people, not just where they're sitting, but also can you have them come in one entrance and out another, or can you have them go up one aisle or another? With that, I'm going to turn it back over to Pastor Diego.
Thank you, Joe. So, one of the big questions that we face these days is about celebrating the holidays safely. There are Christmas Eve services coming up. There are perhaps other kind of events that you are planning, both inside the church or the house of worship as well as with your family. And so, some of the things that we want to recommend again is the use of mask and social distancing. I know that this is like a fine dance that we find ourselves navigating or doing every day because we don't know who has been exposed or who is vulnerable, or we don't know if we are carrying ourselves something already. So it is important that we use those masks. It is important that we do extra hand washing, that we also explain our expectations to people, and preferably to do that before the gathering happens. You don't want to invite people into your environment, whether that is your home or the house of worship or the church, and try to decide those things there when they are just arriving. So be proactive in communicating those ahead of time. Another important thing is understanding where our guests are coming from. Perhaps they're coming from out of town, and perhaps they're coming from areas where the cases of COVID-19 have greatly increased. And so you will at least be able to know how to act appropriately. Another important thing is the outdoor versus the indoor. And I know it's getting colder, so what's a good compromise to not being able to use the outdoor setting? Well, one good compromise might be to move a gathering to a bigger room. Maybe if you have a staff meeting, don't hold that staff meeting in the smallest room in the building. Go to the sanctuary or relocate yourself to a location in the building where there is greater ventilation and there is more air running through that space. Consider limiting the duration of the event. I know that finger food, coffee, hot cocoa after our gatherings, plus fellowship, they're part of the values that we foster in our communities. And so during this season, we may need to just rethink, how do we do that in creative ways? How do we do that without limiting connections between our people? For those celebrating at home, we want you to know that use of alcohol could cloud their judgment and then lower their inhibitions. And when inhibitions are lower, we may be prone to do things that we would otherwise not do, like perhaps get too close to people and talk with them without a mask. In terms of the food, we recommend that you stay away from buffets or spreads of food where people are going to be handling a lot of those things. I know an example that we are using in our local church is we are using for communion the communion kits, which separate the wafer from the juice and reduce the amount of handling that takes place. And lastly, I just want to say there is also the possibility of doing virtual dinners or celebrations. They're not the same, but I can tell you I'm already planning for a game night with my wife's extended family virtually because we know we cannot be together. So those are some recommendations I wanted to offer you. And now Amy is going to tell us more about the visitor limitations.
Thank you, Pastor. We know that this is an issue of great concern as the COVID virus spreads, what happens to visitation. And one of the pieces of feedback that we got from after the first surge was that we needed to be more clear and as much as possible have a regional approach to what happens with this. So the New Jersey Hospital Association and the Department of Health got together and agreed that we would do something that we all can understand very clearly and we'd publicize. And we'd look at the COVID rates within the county. We'd look at the COVID rates within the hospital itself. We'd look at what we're seeing in reference to the transmission throughout the state. And we'd put it all into a cycle, if you will, and try to come up with an algorithm that would say whether or not a hospital region would get red, yellow, green. Now, we are in the southwest region, which actually goes from the Delaware River to the end of Cumberland County. You can think of Inland and Inspira as sort of the last hospital system in that region. And all of the hospitals in this region have to live by the same algorithm, which is done on a weekly basis. And so let me talk to you about what that means, the red, yellow, green. Red is where we are today. Red is the most restrictive, and given what we're looking at in reference to the spread of the virus and what's predicted, I think it's very unlikely that we will actually move off of red, at least in the short-term basis. So red means no visitors. The only exceptions that can be made are in reference to whether or not you have a child in the hospital, you might be delivering a baby, a patient that has dementia or intellectual or developmental cognitive disabilities, and then someone who's at the end of their life. The only other exceptions that can be made, and let me tell you, they will be made almost non-existently, is if there's some special reason that the care team would take into consideration. We know that it's critically important that every one of our available staff have the focus on making sure we're caring for all of the individuals. The good news, which I'm sure you've heard, is that the COVID patients are not in as much need of ventilators as before. However, there are still some that need it, and most importantly, as Pastor Diego already talked about, we're in the middle of flu season. So there are people who receive the flu who get so sick that ventilation is required. So it really is important that all of our experts can be focused on those things. If indeed the setting moves back to yellow, it basically means that there are no visitors for COVID patients or for flu patients or anybody who's immunocompromised, but otherwise there will be one visitor that's permitted per day. Again, you must remain socially distanced, you must wear a mask even in the room with your loved one, and you must continue to wash your hands. We will not allow you to move freely through the hospital. You will only be able to go to your loved one's room and be able to stay there. And then obviously green is not as it used to be because we still are in the time of COVID. So green will allow 2 visitors at a time, and again, no visitors for immunocompromised or COVID patients. So we know that these times are challenging, and I would like to turn it back to Pastor Diego to talk about how we're supporting your parishioners when they find themselves within the hospital. Pastor?
Thank you, Amy. Our goal is to promote the emotional and spiritual support of our patients, which may happen to be some of your congregants or even your own relatives, as we have learned of some. And we also want to make sure that we offer that same support to our staff. As many of you know, since COVID-19 began this year, one of the things that we had to suspend was roundings. And our volunteer force has been also put on hold during this time of COVID-19. So we want to thank you for being patient during this season. I know some of you have experienced some frustrations in the process, but be sure that our commitment is to work with you, with our staff, within our system, to be able to make sure that you accomplish the task of offering emotional and spiritual support. So what visits are we giving priority to? Well, Amy explained, depending on the color, we would proceed accordingly, whether it's green, yellow, or red. But overall, we want to make sure that every visit that originates by the request or in the request of a patient, the relative, or our Inspira staff is honored. And especially if the request has to do with an end-of-life situation, we want to do everything possibly we can to make that happen. In some cases, we will be coordinating with the nurse managers before you can complete a visit in those cases. In some situations where it would be difficult or next to impossible to facilitate an in-person visit, we will make use of technology like iPads, mobile devices, phones, and even the portable devices that we have in the hospital to make sure that you can offer that support to our patients. So I want to ask you, use our spiritual care department. The more communicating you do prior to showing up at the hospital, the better. You will be prepared. The more we will be prepared to help you accomplish your goal. One of the things that I want to mention is every Wednesday evening or Thursday morning, you can go to the website showing on the slide, inspirahealthnetwork.org, and check the status color for visitors. And that way you are well informed of where we might be for the next 6 to 7 days. Also, make sure your clergy badge ID is up to date. I want to commend you because I have been receiving a lot of renewal applications, and we want to continue supporting you in that process. And the last thing our department wants to ask of you is to be flexible. Even though most of these guidelines apply to all the campuses across our network, there may be days or times when the specific leader at each location may add 1 or 2 restrictions or procedures to the restrictions. And so we just ask that you will be flexible and that you call us if you need our assistance. Now, Dr. Balogan is going to tell us more about the testing for COVID-19.
Thank you, Pastor. So as part of our conversation today, I wanted to provide an update in terms of what testing options are available. And so the first decision is always who to test. General 3 categories are persons who are symptomatic. That speaks for itself. That would be someone who presents with COVID type symptoms, flu-like symptoms, headache, the symptoms that we already discussed earlier. Or someone who is identified as being pre-symptomatic or asymptomatic. And so the pre-symptomatic or asymptomatic person would be that person who's been exposed to somebody who tested positive. In the 14-day incubation period, the pre-symptomatic person has not yet started to show symptoms, appears to be healthy, but in that 14-day, the remainder of the 14-day will present with the COVID-type symptoms. The asymptomatic person in the entirety of the 14 days may never present with symptoms. And so the important thing to remember is that depending on when you come into contact with the pre-symptomatic person, and certainly for the asymptomatic person, they appear well or could appear well for most of the 14 days or the entirety of the 14 days. They don't feel sick, but they're infectious. And this again stresses the importance of our mask wearing because they may not yet know that they have the illness, but they are infectious to any persons that they come into contact with. The next thing to discuss is when to test and what test to use. The general premise of the tests that we have available is that the tests will identify current infection or identify past infection. The 2 that we have that will help to identify current infection includes the rapid test that is done at the office or clinic level and provides a result within 15 minutes, so it's extremely convenient. That is collected the same way as the molecular test, which is a send out to lab. And depending on the trends and traffic that most labs are handling, the molecular test result may come back generally within 48 to 72 hours, a little bit longer again as the case rates are going up. The serologic test, the antibody, is a test that allows us to identify past infection. So in consultation with your clinical team, they will help in terms of identifying which test is appropriate for a particular scenario. Inspira has the capacity to offer all 3 tests and also has the capacity to offer this counseling in making the proper decision for the specific scenario. And I will turn the presentation back to Joe Kaufman to present some more information about where testing accessibility is located.
Thank you, Dr. Balogun. So as we've heard, the demand has increased, right? And as it has, we've felt the need to make some adjustments to our testing capabilities. And so we have COVID-19 testing available by appointment. And in Cumberland County, that's being done at a facility which is a drive-through facility at our Millville EMS station. This allows additional occupancy for us to bring people in to get tested, and it also allows our staff to stay out of the weather. In Camden County, we are utilizing our Laurel Springs urgent care. And in Gloucester County, currently, we are tentatively scheduled to open in Woolwich Township on Woodstown Road at the Township Building, which will be another drive-through facility beginning on Monday, December 21st. Also in Gloucester County, we have the Tomlin Station Urgent Care, the Washington Township Urgent Care, and the Williamstown Urgent Care. All of those options are available to you, and we will direct you accordingly after your telehealth appointment, which you can call and schedule. So with that, I'd like to turn it over to Amy.
Thank you, Joe. So there is, amongst all of this difficult news, hope. And the hope is around the vaccine. And as we sit here now, we are awaiting our vaccine and very excited about being able to give it to those frontline workers who have been facing the virus down straight in the eye every single day. Now, we know the vaccine is not a cure, but it will certainly move us tremendously forward in stopping the spread, just like the flu vaccine does. It doesn't solve everything, but it's a huge, huge step forward. I know there has been concern about what does it mean that a vaccine is fast-tracked. Let me assure you that fast-track does not mean that there were shortcuts. The science won. The science told us through the efficacy of those studies that were done that the 2 vaccines that have been approved to this date do meet all of the Federal Drug Administration criteria and are indeed safe and are indeed what we need to move forward on as quickly as possible. The more people who get vaccinated, the harder it will be for this virus to continue to spread. This is our only weapon, in addition to wearing your mask and washing your hands and remaining socially distant, that we have right now. And Dr. Balogun will talk you through some of the details in reference to the efficacy and how it works, but I'm imploring you. It is critically important that as many of us as possible, please get vaccinated. Now, the rules and the how that's going to happen by the time the public actually has it available will change. And so we'd encourage a dialogue with us on a continual basis. Use our Inspira app, use the Inspira website to really make sure you understand what's available and when it's available. But the bottom line message is, please, please make sure that you get a vaccine and really engage with us to stop the spread of this virus. Dr. Balogun, can you talk a little bit more about the vaccination?
Yes, thank you. So as Amy mentioned, there are multiple vaccines in development. The 2 that we have available currently are by Pfizer and Moderna. These 2 vaccines are administered in 2 doses. Pfizer is administered in 2 doses that are set 21 days apart, and Moderna is administered in 2 doses that are set 28 days apart. It is important to mention that the doses or the vaccines are not interchangeable. If your first dose was the Pfizer vaccine, your second dose cannot be the Moderna vaccine and vice versa. So that is important to mention. As well, it's important to mention that both vaccines were extremely effective in the studies. The Moderna vaccine was found to be 94.5% effective in preventing COVID infection, and the Pfizer vaccine was 95% effective. What this means basically is that for the Pfizer vaccine in particular, approximately 44,000 people were enrolled, and they are then separated into two separate groups, equal groups, and randomized, which means that if you looked at the group that received the vaccine, they would look exactly from a demographic standpoint the same as the group that received placebo. So there are two arms, one gets the vaccine, one gets the placebo. And the 95% effectiveness rate is due to the fact that the group that received the vaccine, the Pfizer vaccine, there were only 8 cases of COVID in that group versus the group that did not receive the vaccine, that received the placebo. There were 162 cases of COVID diagnosed in that group. And so we see then, in comparison of the outcome, that there is a 95% effectiveness in the group that received the vaccine. If you compare this effectiveness rate versus other vaccines that we are very familiar with, it's quite impressive. Just to name a few, our annual flu vaccine has 40 to 60% efficacy rate. The MMR vaccine, which is given for measles, mumps, and rubella, has 78% efficacy rate. Tdap, which is tetanus and pertussis, is 80 to 85% effective, and the pneumonia vaccine is 60 to 70% effective. And so not only do we know that the vaccine is effective, we also know that it's safe, and we know that it's safe based on the fact that over a significant portion, thousands of people receive this vaccine, and we're able to determine what types of side effects they developed. In general, the side effects were very mild. They tended to be side effects similar to that we would see from other vaccines, and those are local reactions at the site of the injection. Some persons reported fever, headache. Important to know is that these symptoms were very short-lived, were probably present for approximately 1 or 2 days, and responded to over-the-counter medications such as Tylenol and Advil. So overall, less than 10% of persons who were vaccinated developed developed symptoms. As well, should mention that the vaccine is not a live virus, and I mention this because this is a common question we get about the flu vaccine. It is not a live virus, so there's no risk of someone being given a COVID virus from the vaccination. So now that we've talked about the vaccine and that the fact that it is safe and efficacious, the next question I'm sure is, where can I get the vaccine and where can I direct others to get the vaccine? New Jersey has a vaccine distribution plan, which is aimed at ensuring that we have equitable access for everyone that lives, works, or is educated in New Jersey. And the plan is also committed to making sure that there's minimizes disparity in access across the state. It is going to be distributed through a phased approach that initially focuses on high-risk occupations, such as healthcare workers being direct and frontline, and as well residents of long-term care facilities. And as you can see from this slide, the first phase, again, will be healthcare workers, essential workers, and persons at high risk that are in residential facilities. That will move on to other phases. Phase 2 will complete the vaccination for the remainder of those in phase 1. and then critical populations and general population. And we will then move on to phase 3, which will continue to vaccinate those that are identified as being in the general population. This next slide really just provides a little bit more detail in terms of who is listed in those broader categories. So under healthcare workers, you can see that it would be hospital workers and those that work in long-term care facilities and other areas are also listed there. Essential workers are listed, would include first responders, transportation workers, and law enforcement. Those at high risk would be those that are 65 years of age and older or have a comorbidity that is identified as a high risk. And then the last category would be the general population and communities, and those with disabilities or who are underserved. With that, we'll turn the presentation back to Joe Kaufman to provide more detail in terms of how Inspira can help local clergy.
Thank you, Dr. Bravo. So as we discussed in the beginning with Pastor Diego, we talked about supplies and PPE being an issue at times to be able to acquire. One thing we wanted to let you know is that Inspira has the ability to assist you with purchasing those personal protective equipment and supplies. You would need to reach out to one of us, and we could connect you with our supply chain team, who would be able to direct you accordingly. Also, we're able to provide, evaluation and assistance when you have a potential exposure situation, as Pastor Diego said. Include people and let them know, but also we can give you guidance as to what to do in those situations. So we do have experts available for consultation and guidance, and that includes our pastoral care team. I ask that if you need assistance, feel free to reach out to me, and my telephone number is 856-595-9134. And with that, handing off to Amy.
So lastly, I want to talk through with you some of the resources that Inspira has made available to make sure that you can keep up to date on all the information that we've shared. First, I should want to make sure I say thank you too. It is really important to have your partnership in this process. And again, our goal in trying to provide all this information and making sure you have all these links is that you will indeed share that information as in your role as a community influencer. So let's talk about some of the things we've created for you. We've created a COVID-19 self-checker and a self-monitoring tool that exists within the My Inspira app. And I'll talk specifically and show you photos of how that actually works. The Inspira Health Network has been mentioned a couple times today about making sure that you check that, especially for the changes that may come in visitation. As I told you, given the data, I'm not sure that we're going to get off red until we get enough people vaccinated and we can really start to slow the spread. But at least you'll be able to go there and be able to see what the latest information is in reference to what the visitation policies are. And then most importantly, what we've seen is really the shining light that's come out of this COVID crisis that we've been in is the use of telehealth and telemedicine. Our telehealth exams have provided tremendous opportunity for people to be able to have contact with their doctor, not just through urgent care or primary care, but also their specialists. And we've provided over 80,000 visits since the COVID pandemic created. In this specific situation, the telehealth exam will provide the opportunity to say, do you need a test or not? Understand where you can get a test. And also, the telehealth provides assistance and access to behavioral health services, which again, we've seen a 100% increase in our behavioral health program and have people available to work with your congregants. This is a very, very difficult time, and making sure that we have access to those behavioral health services and that people do not feel isolated and do not go down the steep road of depression. We want to make sure you know that access is available, and we would welcome the ability to care for your congregants if indeed there's someone there who may need that service. So the My Inspira app. Let me tell you, we've put a lot of work into this and really have spoken with a lot of people, including our millennials, who have helped us really improve this app and really talk about how to make sure that it's most useful to you. So probably one of the most useful things is Rosie, right? Rosie is our chat box. She allows us to go in and ask a series of questions and move you through the website very carefully. In this case, Rosie now is up to date on COVID and can help you make decisions about seeking medical care. Dr. Balogun talked about the incubation periods. Getting tests during that beginning period really makes no sense. You could end up with that false negative, and that would give you a sense of comfort that, candidly, you may not have. And so really knowing when to get the test, Rosie will help you move through that. She doesn't give you a diagnosis, though. So for the diagnosis, you still need to go to a virtual visit, and you can do that through our Find Care Now portion of the app. The virtual visits will actually tell you what's open and what's available, and it also will give you the wait times. And I'll tell you that it's been painful to look at some of those wait times, but the demand has been so great, there just is no other way for us to be able to serve you. And that's why we want to be honest about what the wait times are, so you can go to the My Inspira app and really see all those, and that's why we encourage you to sign up for that. It's a very important tool. In addition, access to the patient portal will give you a chance to really make some of those self-monitoring tools. The whole purpose of the portal is trying to empower you. It's trying to give you access to not only your own health information, but help guide you. There's things there that will teach us things, and this is one example that we've put in COVID. It will help you do a daily self-check to see how you indeed are feeling, up-to-date information on how to stay safe. And please be assured, through all of this, your information is safe and it's protected. So you never have to worry about that as part of the My Inspira app. So lastly, I want to make sure you know that we encourage you to do exactly all that we've talked about, right? To reach out our spiritual team. Pastor Diego has represented them today, but in addition, you see on the slide, Hal Russell and Greg Hill are ready and waiting to assist wherever they possibly can. And we really appreciate and understand that you have choices about where your congregants may get their care. And so Inspira wants to be first in giving you this information, first in having the opportunity to be an active partner with you, and first to engage in a dialogue like this so we can make sure that you have access to all the up-to-date information. And with that, I'm going to turn it back to my colleague, Tom Baldessaro, who's going to help answer any of the questions that may have come in.
Thank you, Amy. We just have a couple of questions right now, so if you have a question, please send it in now so we can make sure to get it answered. For the first two questions, I'm going to go to Joe Kaufman. Joe, what would you say the risks are of singing during private praise and worship?
Thank you. Well, I think that in the beginning of COVID, we heard about a choir that was in Washington State in which there were 60 members singing. They took a 2-hour session, and in that session, 53 members were infected and 2 passed away. My recommendation, obviously, due to the risk factors, is to not do that. My hopes would be, that you wear masks if you do have to do that, and also consider virtual.
Thank you, Joe. And the next one for you. What is the recommended length for an indoor meeting where ventilation is reduced or non-existent?
Thank you. As we talked about, ventilation is obviously another portion of the protection factors that you can do. And so if you're in a situation where you're in a, obviously a smaller room with limited ventilation, my recommendation would be to not have that meeting. Obviously, you want to try to give yourself as much room to socially distance as possible. If you're able to aid the ventilation in that room with potentially supplementary fans or air purifiers, those are things that can also help in those particular situations.
Thank you, Joe. Dr. Balogun, next question is for you. When should we consider testing versus isolation?
Thank you. I would recommend testing whenever feasible. So some people are in parts of the country where availability to testing is still an issue. But if you live in an area where that is not the case, I certainly am an advocate of testing, and this is why. Definitively, there are a couple of different things that can present like flu-like symptoms. So we still have to remember that this is the flu season, and some of the symptoms do overlap. The management would be different. When you have the clarity in terms of a diagnosis, it helps in terms of that communication piece that we spoke to. Also helps in terms of the contact tracing. So whenever possible, it is important to make sure that we get the proper information so that we can act accordingly.
Thank you, Dr. Balogun. The next question for you as well. Is it safe to be in church right now?
That is an excellent question. I think that using the methods that we've talked about, the behavioral practices that we've talked about, social distancing, mask wearing, making sure that we self-screen before we gather, certainly does help to make for a safer environment. I think for some persons who are at a higher risk, it may not yet be a safe time to go back. And certainly, we spent a significant amount of time talking about the vaccine. My response would probably be different if, in addition to the social distancing, the mask wearing, and self-screening, in a world where we have now a majority of our communities vaccinated. And I think once we couple those things in, it will be safe to go back. At this time, I would say it's probably not safe for all persons. Some persons who have higher risk may want to wait until the majority of the community is vaccinated. And even then, we will have to continue to maintain these safe practices for the foreseeable future.
Thank you, Dr. Balogun. Diego, Pastor Diego, here's a question for you. When is it appropriate to attend an event as an invited clergy member?
Great question. I would answer that question in a twofold way. The first one is when you can make sure that the event you're going to attend is safe for you, meaning they're going to practice social distance, people are wearing masks, there's hand sanitizers, and there is also an openness to talk about it in kind of what I say is part of the new normal in these days is when you show up somewhere, it's almost like you have to have the conversation of kind of negotiating how are we going to do this and what are the guidelines that we're going to implement. So you kind of talk that through. But if you're going to a safe place, obviously you're safe to go there. But the other side of that is, are you safe to other people? And so with the Get Well loop in the Inspira app, I think that's a great tool. Make sure you use it or explore it because you want to monitor your own symptoms. And if you think that what you may have is going to represent a risk to other people, then I would say it might be best for you not to attend.
Thank you for that great answer, Pastor. The final question before we send it back to Amy here. Dr. Balogun, am I at risk to go to a funeral service for someone who has died from COVID?
No. I think I feel very comfortable with respect to if the concern is from the person.
Code gray with security, emergency room acute. Code gray.
For a moment.
Code gray with security, emergency room acute.
My apologies for the interruption. We are in a hospital setting. But for the question, I just wanted to make sure that I understood. And if I'm understanding correctly, if the concern is that the person died from COVID, I would not expect that there would be risk to attendees at the service. I would expect that the risk to the attendees at the service would be similar to some of the other things that we already talked about, which would be the size of the gathering and the ability to adhere to the infection control and best practice guidance that we've reviewed, which is that are we able to socially distance? Is everyone wearing a mask? And I'll come back to what you said, Pastor, which is so important. I've had numerous examples of family members who have gathered on weekends while someone is waiting for a result, and only for the family members to then find out that the member who was waiting for a COVID test result tested positive. And that's what I call the Monday night call, where, the person then calls and lets everybody know that anyone that they were around over the weekend now needs to go get tested. And so would be the same as what you spoke to if you're going to attend a funeral, which is certainly a sad event and something that, certainly is a closure for some. Make sure that you do it and you do it safely, and make sure that you adhere to the practices. But if the concern is from the particular person who died, I don't see a risk from that type of exposure.
Thank you very much, Dr. Baligan. And now one final question, and then Amy will wrap us up. Amy, we talked about the holidays and the difficulties and the challenges. I'm just curious, what are you doing for the holidays this year?
Tom, that is such a hard question. I have elderly parents, and my mother suffers from dementia. We have assistants in the house to support them 24/7. And I'll be saying Merry Christmas through the door and will not be with them. And while that is a terribly difficult decision for them and for me, it's a heck of a lot easier to make that decision than have to live for the rest of my life that I exposed them to COVID. And so there are difficult decisions to be made. And while I know it feels like what happens if this is the last time, I really am at peace with the fact that if it is the last Christmas I get to spend, I know that whatever happens will not be because of something I did or I selfishly wanted to see them and wanted to hold on to that last moment. There are difficult choices to be made. But as I said before, there is hope. And this vaccine gives us tremendous hope. And candidly, this dialogue gives us hope, because we know that if we engage more stakeholders such as yourself in becoming expert and knowing how to access resources, that you will share this information with your congregants and within the community and make sure that people understand what the truth is about COVID, about the vaccine, and most importantly, about how to access the services that they so desperately need. We are so grateful as part of the Inspira family that we have the opportunity to engage with you in this way. We are grateful to our experts who sit to my right and left, who are never tire of making sure that they are present in the community and be able to be that partner with you that we want so greatly to be able to improve the lives of the people who live our community as well as the health of our overall community. We are fighting a war against this virus, and it will take every single one of us to do our absolute best. And right now, our absolute best is making sure we're wearing our mask, we're washing our hands, and we're remaining socially distant. So I thank you for your time today. I look forward to our continued dialogue. And most importantly, until we meet again, be well and stay safe. Thank you.